And so welcome to the 14th or 13th, I'm sorry, edition of the Continuum podcast. Today I have a very special guest. It is David Lowry, Dr. David Lowry, um, over at UNC Caldwell, and we're really excited to have him. Just wanted to start out with, I guess my first question is, would you be able to walk me through your background
Sure.
and what originally pulled you towards, both medicine and eventually healthcare leadership?
Sure. Well, hey, Josh, thanks for having me today.
Of course.
So I am a physician. I developed an interest in medicine probably during high school. My father had quite a few health problems, and so I was in the hospital with him quite often, and was just really struck by the combination of knowledge and science and the interface with humanity, basically caring for people and making a difference and impact. So I followed a traditional pathway through college. I was actually an Air Force ROTC cadet and continued to medical school at Vanderbilt on an Air Force scholarship. So after medical school, I did my training in internal medicine and served at the United States Air Force Academy in Colorado Springs for a period of years. And then left the Air Force. My wife and I settled in North Carolina, and I intended to do nothing more than clinical work. I worked as a hospitalist for several years, and I found myself as the leader of a medical group, and I held several medical staff positions, chief of staff and such at my hospital, and really started to see that I could have an impact beyond pure clinical medicine. And that led to me becoming a chief medical officer. During my first business meeting, I realized I knew absolutely nothing about business. So I decided to go back to school and earn an MBA, and really through that process learned a lot about leadership as well as healthcare administration, particularly healthcare strategy, healthcare policy, healthcare finance, and that led to my interest in becoming a chief executive officer. So I've been in that role for a few years now.
That's great. That's great. And I think, obviously the MD, MBA, you're able to have two very valuable perspectives, obviously as a clinician, bedside, and then, you kind of take a step back and look at finances of, a certain, not just, it can be local as far as the facility goes, but, a whole group and healthcare network too, which is
Mhm.
really cool. As far as, I mean, that trend, right? Do you think physicians are starting to become more involved in operational leadership today than maybe they were historically?
Historically, back in the 1950s and before, many hospitals were small, physician-run organizations. And I think with the advent of Medicare, Medicaid, and changes in payer systems, where healthcare became more accessible, and as technology advanced and the scope of healthcare increased, hospitals became much larger, and the idea of healthcare systems evolved. Physicians seemed to be left behind. They were content to do their clinical practice and leave the business of medicine to others. And I think recently there's been more of a realization that physicians need to step up to the bat and lead in healthcare. Many physicians still don't understand the vastly complex healthcare system, and are content to practice clinically. But increasingly, I think there's a definite role and a collaborative role for physicians to partner with others in leadership.
Yeah, absolutely. And you've seen healthcare from multiple angles, like we've talked about clinical, operational, executive.
Mhm.
This might be kind of a broad question, but what do you think are some of the biggest challenges that healthcare organizations are facing right now, and from your perspective and from your experience?
Yeah, well, I think the limitation of resources combined with the complexity of the system and the fact that it is so expensive. Easily healthcare consumes 20% at least of U.S. gross domestic product. Our economy is by far the largest in the world. So very easily and conservatively, U.S. healthcare costs over $6 trillion a year. So to put that in perspective, if the U.S. healthcare system were a country, it would be the fourth largest economy in the world. So it is so expensive and in many ways so inefficient. And I think we need to find a way to make healthcare sustainable, which it is not at current state, and we need to make it accessible and equitable. For a country of our size and for a country as advanced as ours is, there's still such a wide disparity in healthcare on many levels, and it shouldn't be that way.
Right. And as far as given your position, where do you see the largest disconnect between leadership goals and the day-to-day execution? As far as, is there a gap? Is there a delta there?
Well, I think there are many, many gaps. I mean, one that I was just discussing earlier today with colleagues, healthcare leaders, healthcare administrators, your executives are very cognizant of the financial difficulty that is in our future. Through the Big Bold Beautiful Bill Act, $1 trillion is being cut from the healthcare system, and some of the programs that have sustained hospitals and healthcare organizations over the past few years are going away, beginning in 13 months with the advent of fiscal year 28, and that is going to be devastating for many smaller rural hospitals, many community hospitals. And I think what I found many physicians in clinical practice have no understanding of the financial cliff that we're heading towards. And the assumption is that the bank accounts of hospitals are full and that resources are unlimited, and that's not the case. So I find that I joke sometimes to say that with an MD and an MBA, I spend time translating MD speak into MBA speak and vice versa. So there is a gap between clinicians and healthcare administrators, leaders, and how to navigate the future.
Right. And I mean, as far as getting a little more specific, what areas of healthcare do you feel are most overdue for, modernization? Whether it's from a patient perspective or, a process perspective internally, operationally, what would you say?
We have a serious crisis in primary care and in healthcare access. And in my state, in North Carolina, there are still rural counties in our state without a single physician in the county. And if you could take one specialist and put them in a county and have the biggest impact on morbidity and mortality, it would be a primary care family practice physician, not a general surgeon, not a radiologist, not a dermatologist, a family practice primary care physician. And we like to spend money on incredible things like organ transplantation, amazing technology, but very expensive. We need to spend more time on getting people accessed into preventative care, having colon cancer screening, breast cancer screening, assessment of lipid profiles to prevent cardiovascular disease. And if we could do that, there are many diseases we could cut off at the pass before we have to spend incredible amounts of money and use massive resources to treat end-stage disease. In our country, compared to other developed countries, the ratio of primary care physicians to specialists in most Western countries is about 3 to 1. In our country, it's roughly 1 to 1. So there's a huge disparity of primary care providers.
Interesting. And I mean, as far as patient outcomes, which you just touched on, a lot of organizations talk about improving patient outcomes because it's obviously it's important. From your perspective, what would you say actually moves the needle in a measurable way as far as improving patient outcomes?
Well, hospitals are wonderful. I spent most of my life inside hospitals,
Hmm.
but hospitals are the most dangerous place to be for patient care. They're the most expensive place for patient care. They're the most uncomfortable place for patient care. So to improve patient outcomes, I think the first step would be preventing illness in the first place, obviating the need for hospitalization. So again, getting back to disease prevention, healthcare screening, keeping people healthy would be the first step.
Hmm.
Once patients are hospitalized, we need to take every step to ensure patient safety and to provide high quality care. I'm proud to say that today my organization is exactly 1 year free of having a CLABSI. A CLABSI is a catheter associated bloodstream infection. And when patients have large IVs placed in the hospital setting, those catheters can be portals for bacterial infection. The truth is that a catheter associated bloodstream infection in a hospitalized patient has a mortality of 25%. 1 out of 4 patients who get an infection will die. And we have, in my organization, we've made incredible effort to prevent those. And we have not had one for a whole year, which is amazing. So I think we need to put an incredible emphasis on patient safety and high quality care. Once a patient's hospitalized, we need to do the same in outpatient ambulatory settings. But first and foremost, we need to keep people out of the hospital, keep them from getting sick in the first place.
I think it's a great point that you made. Obviously, there's a lot of I've been inside a lot of hospitals, mainly ORs, based on my experience in medical device sales, and I could you could tell which I guess from an OR perspective, right now that's only one faction of the hospital, but you could tell who runs a tight ship
Mhm.
versus who is maybe a little more casual about it. Not to say that there's anything wrong with that, but you can just see the different styles. And I think that comes down to that tone is set from the top. But obviously, that not having those infections for a full year is a huge win for your organization. So credit to you on that one. But for sure, now as far as data goes, where do you see healthcare systems maybe underutilizing data today, and what do you think is the most? And this is again another broad question, right? We're talking about the full scope of the hospital, but where do you see healthcare systems underutilizing data today, and where do you think it could be better spent, if better utilized, I should say, if you had any ideas on
Yeah, I don't think we have a problem in that we don't have enough data. I think our problem is that we have too much data.
that? Hmm.
We have reams and reams and reams of data. Just go to a doctor's appointment any day and you'll walk away with a 15-page report with a bunch of data attached to it. But it's not useful data and it's not accessible data and it's not data that easily interfaces. So one of the goals, if a patient goes to see a cardiologist, the primary care physician and the gastroenterologist should all be able to communicate easily. The data from one appointment should be accessible easily to the other specialist or the primary care provider, and it should be pertinent data. So I think my system's made incredible strides in that way. I think AI is going to be a means to better connect and better streamline data so that usable data, the pertinent data, is readily available to everyone in real time. Nothing's more frustrating than in the old days seeing a patient in consultation and realizing that the pertinent x-rays were done at a hospital across the state and that it will take several days to get those images for your review. That's
Yeah,
what data
right.
exists.
Yeah, and I think and that was kind of a great segue into the next kind of question and topic that I had is about AI, right? There's obviously a huge amount of conversation around AI in healthcare, and where the best utilization of this technology is, because I think it's just just scratching the surface, right, of what AI is capable of doing as far as creating and improving efficiency throughout hospital systems and making the patient experience better as well, and making them feel like they're more heard. From your perspective, where do you think, where in particular, um, do you think AI can create legitimate operational or clinical value?
Sure. There are many applications already in existence in healthcare, but one that is particularly useful is a virtual dictation system. So in our system, a physician in the outpatient setting walks in an examination room. Nothing is more frustrating to a patient than when the physician sits down at a computer with their back to the patient and types on the computer during the visit. So we've now adopted a program where the physician brings in their cell phone and puts their cell phone on a table, and then they meet with the patient eye to eye. And the AI on the phone at the end of the visit writes the entire visit, documents the entire visit, physical exam and everything. So that frees the physician's hands and eyes to work with the patient. People argue that AI may limit our cognitive abilities. In other words, we'll stop learning. And I would argue that the opposite case is true. Physicians, care providers have existed for millennia. It hasn't been until the last 100 or 150 years with the advent of vaccinations, antibiotics, surgical techniques, anesthesia, that we really can, quote unquote, cure disease. But what we've done for millennia is sit by the bedside, hold a patient's hand, tell them that they don't have to fear that they'll be alone. We've encouraged them, shown them love, and given them help. And I think over the past few decades, we've lost touch with that. We've been so buried in our technology that we've forgotten our primary role to comfort and love people and to provide hope and compassion. So I think AI, like I mentioned, will enable us to have the time to be human, but also will give us the time to study and learn the cognitive things that we need to have.
Right. And I think that's a great point, David, because, I think that technology has obviously massive pros and massive cons and I think, the human touch that's needed, the most, I think, obviously for patients, for sick patients who might be in the ICU or, um, I think that has gotten lost in the shuffle a little bit, and it's a good point that you made. And I think, from my perspective, AI has the capability of making everyone more efficient, especially in healthcare, and allowing them to more bandwidth to do their jobs at a higher level. And I think there's a lot of really good uses for AI that can be positive, right? As opposed to just relying on it to function. I mean, that's not obviously that's a discipline issue for every person, right? But I think that it does have a lot of great applications to make every process more efficient, and that obviously includes healthcare. Where do you think adoption is realistically headed over the next 3 to 5 years, in particular?
I think there are several big areas in terms of clinical adoption. I think a big effort is on addressing burnout. So both in nursing and among physicians, burnout has been huge, and a lot of that's related to the documentation requirements now. Years ago, I worked in a hospital in Africa for a couple months, and we did our progress notes on little index cards. And they might consist of an entry like patients doing better, will continue IV antibiotics for one more day. Now, that wouldn't cut it for billing purposes and many other reasons. You have to spend probably more than half your day documenting. And so in an ambulatory setting, many physicians do what we call pajama time. They take their computer home with them and type notes in the evening while they're at home, and essentially extending their day into a 16-hour day. And that's untenable. The same is true in the inpatient setting. So, and nurses will stay after shift doing documentation. And again, that's just not something that is tenable long term. No wonder we have a nursing shortage, and no wonder we are developing the shortages in many medical specialties. So I think AI in the clinical setting will free up time so that people can do work efficiently and do impactful work that's meaningful work for the patients without having an untenable and a sustainable life.
Right. And that leads to AI helping on the clinical side, on the operational side, and then ultimately the patient engagement side too, which is a great point that kind of that's the full uh, the full portfolio of what caregivers and providers offer. And so that's yeah, I think that's a great point.
So just on a patient safety side, there are
Yeah.
programs to identify lung cancers, tumors that might or nodules in the lung that might have malignant clues that help streamline the identification of those tumors. Think of dermatologists who, after years of clinical experience, may have seen 10,000 melanomas, but a high resolution AI camera that has photographs or accessed every melanoma that's ever been photographed in world history. I mean, that increases, diagnostic accuracy tremendously.
Absolutely, and I think that the more the technology is refined too, the more people will trust it. I think that it already has a lot of trust because it's been kind of tried and true, but there's a lot of different applications, future applications that people might be a little wary of. But I think overall, it does have that capability in the future. And as far as shifting gears to growth and business strategy from that perspective, healthcare organizations today are under pressure to grow while simultaneously improving outcomes and then reducing costs, as you know. As a medical device rep for a dozen years myself, I know about the cost reduction and I know how valuable that is. And there's a lot of people who have vested interest in doing that, because contrary to what we might believe, you're right, and that there's not a bottomless pit of funds available to you. So, from that perspective, what would you say separates organizations that scale effectively from those that might struggle?
Yeah, I think identifying core mission is very important. Um, Being efficient and eliminating waste is very important. Just a small example, but think of surgical trays. A neurosurgeon may have a different tray in the OR for every single procedure that they perform, with different equipment laid out in specific ways. And say at a major medical center, there may be 10 or 15 neurosurgeons, each of whom have different needs and requirements. So if a tray is not prepared appropriately, then another tray has to be prepared quickly at expense. So having, for example, going back to AI, but an AI program that helps identify precisely what exact tools are needed in the surgical tray each and every time eliminates waste. And any waste in healthcare is very, very expensive. It's like in the military when they used to joke about $600 toilet seats on transport planes. And healthcare is very expensive. A surgical drill that may look very similar to a drill that you'd get at a home improvement store may cost thousands and thousands of dollars because it has healthcare tolerances and specifications. So any time that tool's wasted or not used properly, it's a huge expense. So large healthcare organizations look at ways to eliminate waste, increase efficiency, tailor their service offerings in an efficient way to their market, and also look at a way to provide care holistically and incorporate those who have difficulty accessing the system. I'll tell you this, if a patient has very limited resources, they're going to put off care. They're going to get care, but they'll get it at a late stage. So a patient who might have a cough and a little bit of fever, who goes to their primary care doctor and gets put on an oral antibiotic, is much less of a burden resource-wise to a system than that same patient who puts off care and comes into the emergency department 2 weeks later in septic shock from pneumonia.
Right.
So,
that's a big difference.
counterintuitively, making care accessible for the poor and the disadvantaged is not only the right thing to do, it's not only the humane and ethical thing to do, but it's the financially prudent thing to do. Because the sooner we treat disease, the easier it is to cure, and it's much less financially burdensome on the system. So I would say that successful systems welcome everybody and make it easy to access the system.
Mm-hmm. Absolutely, and taking care of those things while they're still minor, rather than waiting and until they're major. That obviously affects everything. It has a domino effect. The patient, number one, first and foremost, and then the resources that it takes to to heal that patient. And so they're yeah, and that obviously, but that's from a financial standpoint, that's a great way to think about it. Obviously, especially in your shoes. Um, as far as the patient experience and access, one area we hear about constantly is the patient access and engagement. We touched on it already. Do you think that healthcare organizations are meeting patient expectations today from a communication and accessibility standpoint? And if not, how do you think they can improve?
Yeah, well, I think they're trying to, but there are burdens. It requires major paradigm shifts. Like I think in the old days, if you came home from work and you didn't want to cook dinner, you'd go out to a restaurant. But what do you do now? You call a restaurant and they deliver food to your door. I was in New York City not too long ago, and I couldn't count the number of people on motorbikes with, coolers and stuff driving around the city streets delivering food to people. But in healthcare, too often we have a paradigm where the hospital is a big structure surrounded by office buildings and reams of office buildings, and the idea is the patient comes to the hospital, comes to the doctor's office, and really that needs to be flipped upside down. We need to be going to the patients. Ideally, a patient would, in a perfect state, all healthcare could be rendered in a patient's home, and all healthcare providers, all resources would come to a patient's home in the comfort and safety of their home to render care. And that's an ideal state. Obviously, we're not there yet, but the more that we can go to the patient in their home, the advent of virtual services in our county, our main county in Western North Carolina, where my organization's based, a few years ago, we had no psychiatrists in the entire county. The county had a death by suicide rate twice the state average. We built an inpatient behavioral health hospital 5-6 years ago. That's a beautiful building, but we had difficulty finding psychiatrists to staff it. So we partnered with our School of Medicine, and we have world-class faculty physicians from our medical school providing care in our hospital 160 miles away virtually. And then we have psychiatrists providing outpatient care virtually as well. So bringing care to the patients is I think what needs to be done, and it's a paradigm shift, but it's happening.
Yeah, absolutely. I think that there's, obviously there's some logistical barriers there, but I think that that's an ideal state, like you said. I think that dealing with, and I'm in Chicago, right? So, me going over to, Northwestern, where it's all the way east and the traffic and, all that. And, and then having to find parking and I mean, that's an extreme example because it's Northwestern and it's,
Mhm.
huge and it's hard to navigate. But yeah, I think that that's something that ultimately I think will be addressed in some way, shape, or form. As far as, so that's obviously a gap. How important do you think the digital experience is becoming in healthcare? And does that have and what are your overall thoughts on telehealth, the telehealth market that's kind of been happening and been gaining popularity and usage over the last few years?
I think that virtual services, telehealth services that are well regulated and high quality are extraordinarily helpful. So we have experience in my system with business to business telehealth services. So, for example, a critical care physician in the hospital can do a virtual consult with maybe another specialist across the state, and also provider to patient telehealth services. And again, they're very popular with patients because we need to meet the patient where they are. Just because a hospital or an office is open 8 to 5 or 8:30 to 5:30, the patient should be able to access care really 24/7. I mean, if you're a mother of small children and you're working and your kids are in school and one of them's sick, and you shouldn't have to take your child out of school and take time off of work to get a doctor's appointment. And having a virtual appointment with your pediatrician at 9 o'clock at night, that should be an option. And I've seen that work very effectively. Counterintuitively, you'd think that a virtual visit is not as good as an on-site in the flesh visit. And I'll tell you, when we started our inpatient behavioral health virtual service, I received a comment from a patient who said, I've been in multiple behavioral health hospitals over the years. By far, this is the best. That made me feel good. But what she said next really blew me away. She said, the doctor sat down and listened to me. Now, this was a doctor on a TV screen. Okay. When you think about it, it's hard to talk on a TV screen when you're standing up. Mm-hmm. So it forces you to sit down. So the doctor sat down and listened to me. My life has been transformed. For the first time, I have hope. And that's pretty powerful. And that came from a virtual visit.
Yeah.
Yeah. I think we need more well-run, well-regulated virtual services. We need the government and payers to pay for those as well. We should not have insurers saying, yeah, I'm not going to pay for that, doctor. You have to have the patient come to you.
Yeah, I mean that is very powerful, David, because that message coming from a telehealth visit is kind of, telling you that this really, I mean, not that you already probably knew that it worked, right? But like it has that it can, in certain instances, right, that it can have the same effect. Now, maybe orthopedics, it might be tough for, hey, like my knee buckled, I'm feeling something in there. Like, there's certain obviously limitations, but I think there's the vast majority of things that, what are your symptoms? When did this happen? Blah, blah, blah. If it's something that could be, whether it's diagnosed or follow up, I think it could be really helpful too, because especially, I guess, if it is something orthopedic related, then that patient might have trouble getting themselves to the office or the clinic or whatever, what have you. So I think that's really important. As far as I'm sorry, go ahead.
I was going to say you'd be amazed. I know of a
Yeah.
hospital that's doing a virtual neurosurgery service. So you think virtual neurosurgery, how in the world? But think about this, in smaller hospitals, if a patient has some sundowning where they may get confused at night, typically an emergency CT scan of the brain's obtained. And the CT scan may show no acute findings, but there may be an incidental finding, evidence of a small subdural hematoma, a little rim of blood lining the brain in an area. That's not uncommon, and sometimes that can be a chronic finding. But in the absence of a neurosurgeon to read that, the automatic reflex is to call for a helicopter and have that patient transported across the state to a quaternary care service. With a virtual neurosurgery service, a neurosurgeon can come online, assess the patient in real time, look at the studies, and say, based on my neurosurgical opinion, this is a chronic finding and does not need an acute transfer. So the applications are huge.
Wow. I mean, that's incredible. Um, and I think that, all these things and, all these different concepts that we've covered, have been great. And I guess from an executive level, right? From your seat, um, just a couple 5 questions here about like advice and just like what from a leadership perspective, and you got your MBA, you said, and I have one too. And I remember hearing a lot of leadership talk, and there's a lot of different ways to be an effective leader. But I think, what would you say it makes an effective healthcare leader today, maybe compared to 10, 15 years ago? Is there a bigger emphasis on certain things?
Well, that's a tough question. And I believe that leadership can take many different forms. There are many different types of leadership. So I think for any leader, they need to understand their own strengths and their own style and their own way of leading. So I think with leadership, the first thing is to gain insight into who you are and who you aren't, and then to lead from your strengths. So I think it's hard to pigeonhole healthcare leaders into one specific area. I think there's certainly a need for people to understand healthcare finance, but I think there's also a need for healthcare leaders to understand the future, to understand emerging technologies, emerging healthcare trends. Most importantly, I think leaders need to listen to people, listen to their teams, listen to their patients, listen to community stakeholders. I can bring all of the neurologists in the world into my market, but if for some reason the patients in my market are scared of neurologic disease, or they don't want to see a neurologist because they're afraid they'll be diagnosed with Parkinson's or something like that, it would be pointless to bring those people in. So we have to understand the people that we're trying to serve and understand what their needs are ultimately.
Yeah, I think listening is really important. I think that as a leader of any organization, when when the people who report to you and look up to you feel like they're being heard, I think just from a psychological and emotional perspective, I think they respond really well to that, and in their work as well as their livelihoods, their attitudes, the culture of an organization. It has so many positive domino effects when you could do that. So that's really cool. And I guess the future outlook here. I mean, what areas of healthcare, or what would you say you're personally most optimistic about over the next several years? As far as
Yeah.
improvements and whatnot.
Well, I think obviously on several levels I'm excited about advancements in cancer therapy.
Hmm.
Just the whole advent of immune treatments for cancer, that's exciting. And I think some of the advances that we're seeing in immunotherapy and other cancer treatments were things that were uniformly fatal years ago, are in some cases survivable now. I mean, advancements in cardiovascular disease. I think 2 years ago, cardiovascular disease became the second leading cause of death for the first time in 70 years. It dropped from the first highest leading cause of death. So I think advancements in technology are exciting. Um, the I think the sense in I think our country that a trend towards wellness and wanting to prevent disease in the first place, taking personal ownership of disease. Very few people smoke in our country. I watched a television series not long ago that was based in the 1950s, and every character was chain smoking. And I think public education has really advocated that. There's much more of an emphasis on weight management and diet than there used to be. That's exciting to see. I think that something that's exciting to me is the paradigm change from a physician basically telling a patient what to do to a much more collaborative framework where there's a team approach. In the hospital setting, as a practicing physician, I was very dependent on the respiratory therapist, the dietitian, the nursing staff, the physical therapist, the entire team. And I think we're seeing that more throughout the entire spectrum of healthcare, where the patient takes ownership, the patient's made a member of the treatment team, so to speak, and everyone works together. And I know in my system, we're seeing that too, where bench side scientists and clinical researchers are working together to quickly bring new developments to the bedside. So that's something that excites me as well.
Very cool. And that is obviously from a CV perspective, but really everything you said, right? I think that there has been a definite push for, maybe a more holistic approach to, eating and taking care of yourself from a patient perspective. And hopefully that has positive um, results here over the next 5, 10 years. Making this country healthier is obviously, and you're seems like you're doing your part, right, in the western part of North Carolina. But I think that yeah, there is every patient at the end of the day just needs to be responsible for themselves and their family, and how to live a healthy lifestyle while also being able to have fun too, and keep your mobility and keep your having a healthy perspective in life and lowering that stress. I mean, there's so much that goes into it, and I'm sure that you are on top of all of it. So I really appreciate this has been incredibly insightful. I appreciate your perspective. It's rare to speak with someone who understands both the clinical and executive sides of healthcare this well. And I do have one final question, though, David. For all the potential future healthcare leaders, if you had to give one piece of advice to healthcare leaders trying to navigate the next decade of healthcare transformation, what would it be?
I would say to build resilience. So healthcare is not for the faint of heart. It's hard work. And I think outcomes are measured oftentimes in years, and there's incredible pressure. And I think that that to be successful, you have to have a holistic life. You have to have a balance. You have to feed all your spirit, your soul, your physical body, your emotional being to be strong to handle all the things that will come at you. So my word of advice would be become a healthy, well-balanced person who can be in it for the long haul.
Love it. I love it. That's great advice. And again, I really appreciate your perspective and you taking time to meet with me today. And yeah, this will be up. I'll send you an email at some point within the next 24 hours with the link, and you can feel free to post it. But yeah, this has been great, and I appreciate the time, and it's been great talking to you, getting to know you, David.
Yeah, thank you, Josh. Anytime, you call me if you need.